Hello, this is Professor Capron. Welcome to today's presentation on the ECG graph. So these are our learning objectives for this presentation. By the end of this presentation, you will understand the basic structure and components of the ECG graph. You will be able to interpret the y-axis and the x-axis on the ECG graph. You will recognize the significance of large and small boxes on the ECG graph and be able to identify the usage of ECG markings and their importance in diagnosing arrhythmias. These are our key terms for this presentation. I will not be reading them to you, but you do need to pause, get these written down, and make sure that you understand each of these terms. If you are still struggling after you've watched the entire presentation, please come see me. Thank you. Let's take a look at this. It is an ECG graph. ECG stands for electrocardiogram. And you may hear also called an EKG because it was invented in the Netherlands back in 1895, and they spell cardio with a K in the Netherlands. But we call it an ECG here, and the graph provides a visual representation of the heart's electrical activity. Essentially, it's a graphical display of the electrical impulses that travel through the heart during each heartbeat. These impulses are recorded via electrodes that are placed on the patient's skin and are then translated into waveforms on graph paper or a digital display. Each waveform corresponds to a specific electrical event in the cardiac cycle, such as atrial and ventricular depolarization and repolarization. The importance of the ECG graph be overstated. This is a critical diagnostic tool for identifying and diagnosing a wide range of cardiac arrhythmias and conditions. Let's take a look at why. First of all, the ECG graph allows us to detect arrhythmias. These are abnormal heart rhythms. They can range from relatively benign conditions to life-threatening ones. By analyzing the ECG, we can identify whether the heart is beating too fast, too slow, or irregularly. Beyond arrhythmias, the ECG graph is also instrumental in diagnosing other cardiac conditions, such as myocardial infarction or a heart attack, electrolyte imbalance, and structural abnormalities like hypertrophy or dilation of heart chambers. Each of these conditions produces specific changes in the ECG waveforms, which allows for accurate diagnosis and timely intervention. For patients with known cardiac issues, the ECG graph is used to monitor their heart health over time. This is particularly important for patients who have undergone procedures such as pacemaker implantation or those on medications that affect heart function. Regular ECG monitoring helps in adjusting treatments and ensuring that the heart is functioning optimally. When patients are treated for cardiac conditions, whether through medication, surgery, or other interventions, the ECG graph provides immediate feedback on the effectiveness of the treatment. Changes in the ECG can indicate whether a treatment is working or if adjustments are needed. And in some cases, the ECG is used as a screening tool to detect potential heart problems before they become symptomatic. This is valuable in high-risk populations, such as the elderly, athletes, or individuals with a family history of heart disease. Understanding the ECG graph's role in these areas is fundamental to providing comprehensive cardiac care. We'll go into each of the specific components of the ECG graph and learn how to read them effectively. Okay, so let's break down the components of the ECG graph. The y-axis on the ECG graph measures the electrical activity of the heart in millivolts. This axis is vertical, it goes up and down, and it indicates the amplitude or strength of the electrical impulses that travel through the heart. When we look at the y-axis, each small box represents 0.1 millivolts, and each large box represents 0.5 millivolts. This measurement helps us to determine the voltage changes that are occurring during each heartbeat. Higher spikes on the y-axis indicate stronger electrical activity, which is typical during the depolarization phases of the cardiac cycle. Conversely, lower spikes or flatter lines indicate weaker electrical activity or repolarization. The x-axis measures time. It is horizontal. This axis allows us to see how long each part of the cardiac cycle takes, which is essential for identifying any delays or abnormalities in heart function. Each small box on the x-axis represents 0.04 seconds, and each large box represents 0.2 seconds. By counting the number of boxes at certain points on the ECG, we can calculate the duration of different phases of the cardiac cycle, such as the PR interval, the QRS duration, or the QT interval. Let's talk about those boxes a little bit more specifically. The large boxes. So you'll see there's a bunch of teeny boxes, and then there's darker lines for large boxes. Each large box on the ECG graph represents 0.20 seconds horizontally, remember that's time, and 0.5 millivolts vertically, that's voltage. So the large boxes are useful for quickly estimating the duration of intervals and the amplitude of waveforms. For example, if a waveform extends across two large boxes vertically, it represents an electrical activity of 1 millivolt. Similarly, if the interval between 2 points on the x-axis spans 5 large boxes, that's a duration of 1 second. Now let's look at those little itty-bitty smaller boxes that are inside the large boxes. Each small box represents 0.04 seconds of time horizontally and 0.1 millivolts vertically. Small boxes provide us with more precise measurements. These are particularly useful for calculating short intervals or any little minor changes in voltage that we need to be aware of. For instance, the duration of a typical QRS complex, which should be between 0.06 and 0.12 seconds, can be measured in small boxes to ensure accuracy. This is done by counting the number of small boxes from the start to the end of the QRS complex. Understanding these components of the ECG graph is fundamental to interpreting the heart's electrical activity accurately. By using the y-axis and the x-axis, along with the measurements provided by large and small boxes, and yes, you need to memorize those, we can determine the timing and strength of each phase of the cardiac cycle. This precise measurement is essential for identifying arrhythmias, conduction delays, and other cardiac abnormalities. Let's take a closer look at the y-axis on the ECG graph. Remember, that represents voltage. This axis is crucial for measuring the electrical intensity and electrical activity of the heart. So remember, the y-axis on the ECG graph is the vertical axis. It measures the voltage of the electrical signals produced by the heart. Voltage refers to the strength or amplitude of the electrical impulses as they pass through the heart's tissues. The primary function of the y-axis is to indicate the voltage of the heart's electrical activity. When we record an ECG, we are capturing the electrical activity that triggers heartbeats. These electrical signals are generated by the movement of ions across the cell membranes in the heart. The different waves and complexes that appear on the ECG tray, such as P waves, QRS complexes, and T waves, correspond to the depolarization and repolarization of the atria and ventricles. These electrical events create changes in voltage, which the ECG graph captures and displays. Remember, on the y-axis, each large box represents 0.5 millivolts. This allows us to measure significant changes in the heart's electrical activity, and if a QRS complex extends across two large boxes vertically, this indicates that the voltage of that complex is 1.0 millivolts. Each small box on the y-axis represents 0.1 millivolts. The small boxes provide more precise measurements of the voltage. For instance, if a waveform spans 5 small boxes, it signifies a voltage change of 0.5 millivolts. Accurately measuring the voltage is essential for diagnosing various cardiac conditions. For example, low voltage QRS complexes might indicate pericardial effusion or hypothyroidism, while high voltage might suggest left ventricular hypertrophy. So understanding how to read and interpret the voltage measurements on the y-axis is fundamental for analyzing the ECG. The height of the different waves and complexes gives insight into the electrical activity within the heart and helps to identify potential abnormalities. Let's take a closer look at the x-axis of the ECG graph. The x-axis on the ECG graph is the horizontal axis. It measures time, specifically the duration of electrical events in the heart. This axis helps us to track how long it takes for electrical impulses to travel through the different parts of the heart. This allows us to see the timing of the heart's electrical activity. When we observe the ECG graph, we can see how the electrical impulses move through the heart's conduction system, starting from the SA node, passing through the AV node, and traveling through the ventricles. The x-axis allows us to measure the intervals between different waves and complexes on the ECG. For example, the PR interval, the QRS duration, and the QT interval are all measured along this axis. These intervals provide crucial information about the conduction times and can help identify abnormalities such as blocks or delays in the electrical conduction system. On the x-axis, each large box represents 0.20 seconds. This allows us to measure the duration of longer intervals and segments. For instance, if the PR interval spans one large box, it indicates a duration of 0.2 seconds, which is within the normal range for the PR interval. Each small box on the x-axis represents 0.04 seconds. These small boxes provide more precise measurements of time. For example, if the QRS complex duration spans 3 small boxes, that signifies a duration of 0.12 seconds. Understanding the timing of the heart's electrical activity is critical for diagnosing various cardiac conditions. For instance, a prolonged PR interval might indicate a first-degree AV block, while a prolonged QRS duration could suggest bundle branch block or ventricular hypertrophy. So let's break down the significance of measuring time on the x-axis. The PR interval is the time from the start of the P wave to the start of the QRS complex. It represents the time taken for the electrical impulse to travel from the atria to the ventricles. A normal PR interval ranges from 0.12 to 0.20 seconds. A prolonged PR interval can indicate an AV block. For the QRS duration, that's the time from the beginning to the end of the QRS complex, and this reflects the time taken for ventricular depolarization. A normal QRS duration is 0.06 to 0.12 seconds. A prolonged QRS duration or a wider QRS complex can suggest a bundle branch block or other ventricular conduction delay. The QT interval is the time from the start of the Q wave to the end of the T wave. It represents the total time for ventricular depolarization and repolarization. The QT interval varies with heart rate, and corrected QT, or QTC, is used for more accurate assessment. Prolonged QT interval can increase the risk of ventricular arrhythmias, such as torsade de pointes. So remember, the x-axis on the ECG graph is our tool for measuring the time of the heart's electrical activity. Let's take another look at the large boxes. A large box on the ECG graph is the larger grid square that's formed by the intersection of horizontal and vertical lines. These help to accurately measure electrical activity over time and the magnitude of that activity. So remember that we measure time on the x-axis, and each large box equals 0.2 seconds. This helps us to measure longer intervals in electrical activity. If we have a series of events on the ECG that spans 5 large boxes, we know that this activity took place over 1 second because 5 large boxes times 0.2 seconds each equals 1 second. Also, if we're going on the y-axis, each large box represents 0.5 millivolts, and this helps us to determine the amplitude of the electrical activity. If the height of a wave spans 2 large boxes on the y-axis, we can interpret that the voltage is 1 millivolt because 2 large boxes times 0.5 millivolts each equals 1 millivolt. These large boxes help us to measure longer intervals of time and bigger differences in voltage. So let's talk about time. PR interval. By using the large boxes, we can easily measure the PR interval. Remember, this interval normally ranges from 0.12 to 0.2 seconds, which means we want it to be one large box or a little bit less. QT interval, this is another critical measurement, and this extends from the start of the Q wave to the end of the T wave. Again, it's the total time for ventricular depolarization and repolarization, and a prolonged QT interval can be a marker for potential arrhythmias. Now let's look at the voltage measurement. Remember that the amplitude or height can also be measured with large boxes. Typically, the P wave amplitude should be less than 2.5 small boxes. So 2.5 small boxes would be about half of a big box. That would be a normal atrial depolarization, about half of a big box. The QRS complex, well, that amplitude can vary very wildly, but it's usually between 1 and 3 large boxes, so 0.5 to 1.5 millivolts. An excessively high amplitude may indicate hypertrophy of the ventricles. A very low amplitude, well, we might have pericardial effusion. Our patient might be obese. Our patient might be hypothyroid. There's a few different things. So remember that we're going to diagnose arrhythmias and evaluate heart function using these large boxes. Once again, let's look at those small boxes. Remember, there are 5 small boxes in every large box, and that's either going across or up and down. Okay, so a small box on the ECG graph is the smallest grid square that's formed by the intersection of horizontal and vertical lines. These are going to help us to measure detailed aspects of the heart's activity. Each small box on the horizontal x-axis represents 0.04 seconds. This is going to help us when we have to determine really short intervals in the heart's electrical activity. Remember, the exact duration of the QRS complex should only be about 0.12 seconds. It's very small. So those small boxes give us the detail needed to calculate it accurately. Each small box on the vertical or y-axis represents 0.1 millivolts, and this helps us to evaluate the amplitude of even the smallest waves and fluctuations in the ECG. Even small variations in the P wave or the ST segment can be detected and measured accurately using the small boxes. So these are for shorter intervals of time and finer details of voltage. So again, the PR interval, yeah, sure, we can use the large boxes for just an estimate, but the small boxes let us measure it with greater precision. The PR interval should be between 0.12 and 0.2 seconds, or 3 to 5 small boxes. This very precise measurement can help us to identify conditions such as first-degree heart block. QRS duration, well, that's very critical for diagnosing bundle branch blocks. Normally, the QRS duration is between 0.06 and 0.12 seconds, and that's 1.5 to 3 small boxes. So we really need to use the small boxes to accurately measure the QRS duration. Remember that for voltage measurements, that wave amplitude going down on the y-axis, those small boxes again allow for precise measurement. Normal amplitude of the P wave is less than 2.5 small boxes. Any increased amplitude may mean we have an atrial enlargement. When we talk about the ST segment and you learn what that is, any small deviation in the ST segment can indicate ischemia or infarction. So accurate measurement of these deviations, which are often less than 1 millivolt, is critical for timely diagnosis and intervention. And variations in T-wave amplitude and morphology can indicate electrolyte imbalances, ischemia, or other cardiac conditions. So it's very important to understand how to measure both time and voltage using the small boxes. Now let's talk about other markings that you're going to see on the ECG strip. These are going to help you accurately interpret and diagnose cardiac conditions. So ECG markings are those vertical lines that you see printed on the ECG graph paper at consistent intervals. These lines serve as reference points that help in the precise measurement of time and heart rhythm. Look at the top of the graph that you see on the right. You'll see the shorter and longer red line that extends above the graph. These are the markings I'm talking about. Okay, so the primary function of ECG markings is to indicate specific time intervals, typically in 3-second increments. These intervals are essential for determining the duration of various segments and intervals within the ECG tracing. By providing a consistent time reference, these markings allow for the accurate assessment of heart rhythm, helping to identify irregularities and arrhythmias. One of the critical uses of ECG markings is to measure heart rate accurately. By counting the number of QRS complexes within a 6-second strip, now that's 2 of the 3-second intervals, and then multiplying that by 10, we can quickly estimate heart rate. For example, if there are 8 QRS complexes in 6 seconds, the heart rate is approximately 80 beats per minute. ECG markings help in evaluating the duration of various intervals and segments as well, and they help us to take a good look at various arrhythmias, particularly those that involve differences between the RR intervals, which is the distance between QRS complexes, or it can help us to see, is the P wave and the QRS, are they working along in the same set of intervals, or are they on completely random schedules, which would mean we have a 3rd-degree heart block and the atria and the ventricle, they're not talking to each other at all. So it's super important that you locate those vertical lines and understand what they mean. Now I want to talk about the concept of the baseline on the ECG graph. Understanding the baseline is fundamental for accurately interpreting ECG readings and identifying any deviations that indicate abnormal heart rhythms. The baseline is also called the isoelectric line, and that's the flat horizontal line on the ECG graph. It represents the period when there is no electrical activity in the heart, and it serves as a neutral reference point against which all other electrical activities are compared. The baseline is crucial for identifying when the heart is at rest. It helps to distinguish the various waves and segments that occur during different phases of the heart's electrical cycle, and when there is no depolarization or repolarization happening, the ECG trace returns to this flat line. So the baseline serves as a reference point for identifying and measuring the electrical activity of the heart. Allows us to see the deviations that correspond to different parts of the cardiac cycle, such as the P wave, the QRS complex, and the T wave. By comparing the various waves and segments to the baseline, it's possible to identify abnormalities in the heart's electrical activity. Deviations from the baseline indicate periods of depolarization or contraction, or repolarization, which is relaxation. The position of the waves relative to the baseline helps us to diagnose various cardiac conditions. For example, elevations or depressions in the ST segment relative to the baseline can indicate myocardial ischemia or infarction. Consistency in returning to the baseline after each wave ensures the accuracy of the ECG reading. It confirms that the ECG machine is functioning correctly and that the heart's electrical system is returning to its resting state properly. Recognizing the baseline helps to differentiate between true cardiac events and things that are just artifacts or noise on the ECG. Artifacts are irregularities caused by external factors like the patient moving, poor electrode contact, or electrical interference. A stable baseline helps us to identify these non-cardiac deviations. So in a normal ECG, the baseline is flat and stable. It serves as a clear divider between different waves and complexes. This stability is essential for accurately measuring both the durations and the amplitudes of the P wave, the PR, the QRS complex, the ST segment, and the T wave. Pathological changes such as ST elevation or depression, significant Q waves, and T waves inversions are measured relative to the baseline. These changes can indicate conditions like myocardial infarction, ischemia, or electrolyte imbalances, and variations in the baseline itself can sometimes occur, such as a wandering baseline, which usually results from patient movement, patient breathing really deeply, or we just didn't get good adhesion on those electrodes. Recognizing these anomalies ensures they don't get misinterpreted as pathological findings. So, how do we use the ECG graph as a part of clinical practice? Well, it helps us to see the heart's electrical activity, diagnose cardiac conditions, and monitor patients continuously. Remember, the ECG graph provides a real time visual representation of the heart's electrical activity. It captures the depolarization and repolarization of the atria and ventricles, displayed as distinct waves and complexes on graph paper. Each segment and interval on the ECG corresponds to a specific part of the cardiac cycle, allowing healthcare professionals to interpret the heart's rhythm and function. The ECG is essential for identifying and diagnosing arrhythmias. By analyzing the patterns, waveforms, intervals, and overall rhythm, we can detect abnormal heart rhythms such as atrial fibrillation, ventricular tachycardia, and more. Each arrhythmia has a characteristic pattern on the ECG that helps in diagnosis. The ECG is critical for diagnosing myocardial infarction, ST segment elevation or depression, T wave inversions, and the presence of pathological Q waves can indicate myocardial injury or infarction. Early detection through ECG allows for prompt treatment, which is vital for patient outcomes. Electrolyte imbalances such as hyperkalemia and hypokalemia manifest as specific changes on the ECG. For example, hyperkalemia can cause peaked T waves. A hypokalemia can result in flattened T waves or the presence of what we call U waves. Identifying these changes helps in diagnosing and managing electrolyte disturbances. And the ECG can also help us to identify structural abnormalities of the heart, such as hypertrophy, which is a thickening of the heart muscle. For instance, left ventricular hypertrophy, LVH, presents with increased amplitude of the QRS complexes. Identifying these changes can prompt further diagnostic testing like echocardiography. The ECG is used in continuous cardiac monitoring, especially in critical care settings. Continuous monitoring allows for real-time observation of the heart's electrical activity, enabling immediate detection of arrhythmias, ischemic changes, and other cardiac events. This is particularly important for patients with acute coronary syndromes, heart failure, or those undergoing surgery. Telemetry involves remote monitoring of the ECG. Patients can be monitored continuously while being mobile within the hospital or even at home. Telemetry units send ECG data to a central monitoring station where healthcare professionals can review and respond to any abnormalities. The ECG to monitor the effectiveness of treatments for cardiac conditions. For example, after administering an antiarrhythmic medication, we can observe for changes in the ECG to determine if the medication is restoring normal rhythm. Similarly, after interventions like percutaneous coronary intervention or PCI for myocardial infarction, the ECG can show resolution of ischemic changes. For patients with pacemakers, the ECG helps in assessing pacemaker function. It can verify that there's appropriate pacing and capture, ensuring that the pacemaker is correctly regulating the heart's rhythm. Any abnormal pacemaker spikes or failure to capture can be identified and addressed promptly. So just a quick recap of what we covered. The components of the ECG graph are the large boxes, the small boxes, the x-axis, the y-axis, the ECG markings, and the baseline. And you need to understand the significance of each one of these items. We're going to look at that more closely as we go into the separate rhythms and you learn how to interpret what's going on. Thank you for paying attention during this presentation. Now go out, go do some nursey things.